Hi there, good morning. Enjoy a cozy morning with me while I answer questions about OCD. I asked everyone on Instagram to send me any questions that they had about OCD, and I got 395 questions. So obviously I'm not answering all 395 questions, but there was a lot of overlap, thankfully. So I am going to cover as much as I can because I want to teach everyone about the world of OCD. Before I jump in, I wanted to go over a little bit of OCD terminology so that you know what I'm talking about when I answer some of these questions. The first is ERP, which stands for Exposure and Response Prevention Therapy. This is the gold standard for OCD treatment, and this is how I manage my OCD through the NOCD app. The second is BFRB, which stands for Body Focused Repetitive Behaviors. And that can be things like biting your nails, pulling your eyebrows like I do, or trichotillomania, hair pulling. And the last few are intrusive thoughts, which are thoughts outside of my control that bring me a great deal of discomfort. Ego dystonic, which means a thought that is against my own feelings or values, something I would never do. And a compulsion, which is an action, whether it be mental or physical, that I do as a result of an intrusive thought that brings me comfort. For example, if I'm feeling like my heart is fluttering, or I might have an intrusive thought that my heart's skipping a beat, my compulsion would be checking my pulse. Okay, a lot of people know that I love to cook. So the first question that I received is, does OCD affect your cooking/eating habits? And the answer is yes. Prior to ERP, I would obsessively check all of my dishes for fibers, hair, foreign objects. I would look so closely and see if there was even just like a piece of fuzz from a towel. And then I would either completely not use that dish or I wouldn't eat. The more I would think about it, I would start to be like, oh my God, I feel the hair in my throat. I have a globus sensation, like that, sort of like that knot in your throat. I would focus on all of that for so long to the point where I would either not eat or I would have to completely use a different dish. But thankfully, ERP has helped me significantly where I would exercise. Oh, there might be a piece of hair in my food. There might be a fiber in my food, and it's not going to kill me. It's not going to hurt me if I consume a piece of fuzz. You know how many spiders humans consume in a year? It's like 80. That gave me a little peace of mind, and over time, that thought stopped scaring me. Question number 2, are your compulsions at all mental? If so, what has worked for you? So a great majority of my compulsions are mental, and I do have a lot of physical compulsions as well. One of my physical compulsions, which I just talked about briefly, was checking my pulse. So I have a lot of cardiac anxiety or cardiophobia, so things centered around my heart. So I will constantly check my pulse. But what helped me significantly with my physical compulsions was just trying to delay the compulsion as much as possible. Whenever I have the intrusive thought of, oh, there's something wrong with my heart, the longer I can go without doing this, even if it's like 10 seconds, that's still a win, because longer and longer, you're not doing it as much. I have worked very hard on my mental compulsions because sometimes they're a little bit tougher to catch than doing physical things. So with my mental compulsions, I try my best to acknowledge an intrusive thought as, oh, that's an intrusive thought. That doesn't really align with my values, and then I just try to pass it. What I don't do is fight that thought and say, oh my God, I would never do that. Why am I thinking this? Oh my gosh, I must want to do it if I'm thinking it. That compulsion, I try to delay as much as possible. Question 3, do you experience any BFRBs? Body focused repetitive behaviors. And yes, I do. And I am trying very hard to not bite my nails. Please. Terrible. I chew my nails pretty badly. This is something that it's a tough one for me, and it's very difficult for me to break. So I try to catch myself biting my nails, and then I will literally sit on my hands so that I don't do it. So that's something that I'm trying to delay as much as possible. Something else that I have started doing, since this technically is a harmful compulsion that I have. I will constantly just look at the skin and look for imperfections, and then I'll bite where I feel like that needs to be bitten. What I have done instead, I have sort of channeled the compulsion in a different way to where I'm not harming myself. So what I do instead is every time I feel the need to bite my nails or pick the skin around my nails, I go on my phone and I check the weather app. And I know that seems strange, but I'm sort of changing the compulsion, and I'm directing the compulsion to something that does not harm me. I know this sounds really silly, but I went into my weather app years ago and I put in a random place that I have never heard of. In this case, this place is called Svalbard. I don't know if I'm pronouncing that correctly. Shout out to Svalbard though, because every time I try to go pick my nails, I say, you know what? What's the weather like in Svalbard? And then I go and look and I check the weather there. I've never been there. I might not ever go, but that's what I do instead of making my skin bleed. Question 4, how to help when the theme of OCD is constantly changing. One thing that's important to remember is that when you're managing your OCD, the theme of the thought does not matter because all OCD is treated the same through ERP. That's the gold standard. So through ERP, you are able to manage the response to those intrusive thoughts that you're having, whether it be, what if I have a heart attack? What if I get hit by a car while I'm walking down the street? What if the next car that passes me is white and then that means my mom is going to have a bad day? I don't know. Whatever cause and effect your intrusive thought will bring you. All of this can be managed through ERP. It's important to not focus on the theme of the thought, because with ERP, practicing ERP enough and exposing yourself to these intrusive thoughts to mitigate the response that your body has, overall, this will decrease as a whole. What's important to remember about OCD is that we can't control our intrusive thoughts. We can't control every thought that comes into our mind, but what we can control is our response to that thought. Question 5, what do you think the most difficult thing about living with OCD is for you personally? For me, prior to treatment, I denied myself a lot of opportunities. There was a lot of things that I convinced myself that I couldn't do because of my OCD, or I would let my intrusive thoughts win and keep me from doing things. I mean, I missed so many flights. I didn't go on so many trips. I missed important events. I was even casted for a TV show that I really wanted to go on that I ended up not doing because my intrusive thoughts told me that I was going to panic the whole time. I was going to have panic attacks. In this case, it was a situation where I was going to have to be away from the comfort of my home, living in a hotel for 8 weeks. And I got so worked up about it that I actually pulled out of it the night before I was supposed to leave. And I will regret that forever, but had I done treatment prior to that, and if I found OCD sooner, truly, I believe that I would have gone on that show and I probably would have won. In terms of flights and trips, prior to ERP, I would not get on the plane for a 1-hour flight. And I guess for perspective on how well ERP works, I just got back from Greece 2 weeks ago. I flew 12 hours there and 14 hours back, so I think it's safe to say that ERP does wonders. Question 6, has OCD ever impacted your relationships? Yes, absolutely. OCD mind is complex, and sometimes it requires a little bit of patience to understand why someone with OCD is doing the things that they do, or has the rationale or the thought process that they have. I have had OCD impact my relationships in the past because sometimes I didn't want to do things and I had no real reason for wanting to do things. Like, hey, do you want to go to this birthday party? And my mind is saying, you shouldn't go to that birthday party if someone's gonna show up with a gun. Like, it would be things like that I had no real reason or rationale behind these intrusive thoughts, but that intrusive thought would bring me so much anxiety to the point where I wouldn't want to do things. So a lot of times I have been limited in the things that I want to do, and that, of course, that impacts friendships, that impacts romantic relationships, it impacts your relationship with your family. The more I was restricting myself and not wanting to do things and go places and participate, absolutely was impacting my relationships with people. Question number 7, did you think you had OCD? Were there early signs that you noticed? Actually, I didn't. I think because for so long I was misdiagnosed as just having really bad anxiety, and it wasn't until I got diagnosed, which gave me like such an immense amount of relief when I got diagnosed with OCD, because I felt like I finally had an answer for my behaviors that made sense beyond just being anxious. But once I got diagnosed, I was able to sort of lay my life on the table and be like, interesting. So I wonder, when I was younger, when I constantly had intrusive thoughts that I was gonna accidentally hurt my cat one day, and I would have panic attacks over it. Oh yeah, okay, that checks out. I think that was probably OCD. Or even when I was younger, I experienced extreme relationship OCD, where I would have like a boyfriend in middle school or something, and I would have these intrusive thoughts like, you have to get away from them, you have to get away from them, you can't be around them, you're gonna break their heart, you're gonna hurt them, you're gonna be the reason that they can never find love, you're gonna break their heart. I don't know, something. I don't know what exactly I was so afraid of that was going to happen, but these cycles of intrusive thoughts used to eat me up and be so strong. But since I pursued ERP, I don't deal with that anymore. I know that it's safe for me to have those thoughts. Those thoughts aren't going to hurt me. It just depends on how I respond and how I react. Question 8. So I did just elaborate on this a little bit, but the next question is, did you ever go through misdiagnosis before OCD? If so, did that impact your OCD? Yes, I was misdiagnosed for years and years and years and years. I was not diagnosed correctly, actually, until I started with NOCD. And it gave me such relief to receive that diagnosis, because after years of being told, oh, you just have really bad anxiety, you have extreme anxiety, you have generalized anxiety disorder, it was very isolating to be diagnosed with just bad anxiety, because I knew so many people with bad anxiety or generalized anxiety disorder, and I was like, I don't think like them. This is beyond that. This is not the same thing as just being anxious. I'm having frequent, horrifically distressing, intrusive thoughts all day long. And the way that I described it to my talk therapist, which I didn't really receive much benefit from talk therapy for OCD specifically, I would always explain it as, knowing the truth doesn't make the thought go away. Knowing the logic doesn't make the thought go away. Why is that? Because the frequency and the level of distress is so different with people that have OCD versus anxiety. And I didn't understand that at the time. I actually didn't even really understand intrusive thoughts and the fact that I couldn't control them at the time. But knowing that and pursuing ERP and practicing ERP and making it literally my religion has given me freedom from those thoughts, and truly it has given me my life back in every way. Which brings me to my next question. Can you explain the treatments that have worked for you? As I just mentioned, ERP. It is the gold standard for OCD treatment. Truly has altered my life in the best way possible. I cannot believe the person that I was before it. And I was very much somebody who thought that they were beyond help, couldn't receive help. It was just so bad. And when I look back at the person that I was before ERP, they're sort of unrecognizable in the best way. So I cannot swear by ERP enough. Please try it. Someone asked, is there a point where ERP gets easier? I cannot tell you how many times I was asking myself that at the very beginning of my ERP journey. Actually, in full transparency, the first time I tried ERP, I had to give up because I was like, oh my God, like I can't be faced with these thoughts all the time. What do you mean you're telling me to just think about my intrusive thoughts and tell myself, oh, well, yeah, this might happen. You might jump in front of a car. You might get a blood clot. You might have a heart attack. Saying things like that over and over, it was like, why would I want to repeat my worst fears to myself over and over? I did not understand at first, but thank God I stuck with it. I am so happy that I stuck with it, because that person that was so scared at first, they don't live here anymore. It was pivotal to my journey with OCD to push through and really commit to my ERP. They always say, feel the fear and do it anyway. That is my motto for ERP. And the last question is NOCD genuinely helpful? And the answer is yes, 1000%. I believe so strongly in the modality of ERP for OCD. The way that it changed my life, I can't even begin to quantify how much it has done for me. And I will never stop talking about it, because if it worked for me, it can work for anyone struggling with OCD. I was so down bad, and going through ERP and committing myself to this modality and using NOCD has totally transformed the trajectory of my life in such a positive way. I don't say no to anything now. And prior to treatment, I like to say I was an inside cat. I did not want to do anything. I was limiting myself so much in life, and now it's like this veil's been lifted and all of these doors are open, and I don't have to live in fear anymore of my intrusive thoughts, because me and my intrusive thoughts used to push each other, and now we hold hands. I know that's kind of silly, but that's how it feels. I don't live in fear of myself or my own mind, and I really just committed to myself, and NOCD helped me do that. So yes, absolutely, 100,000,000,000%. Thank you so much to anyone who submitted questions. There were a ton more I'm planning on answering on my Instagram story. Please try NOCD if you are in need of OCD treatment and you want to pursue ERP. I cannot recommend it enough. Thank you so much for watching.